Do you struggle with gout and want to prevent painful flares without medication? Let's talk about the foods that make gout worse and what you should be eating instead. Hello, this is Dr. Siddharth Amber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge treatments. Gout is one of the most common causes of joint pain, especially in men and in people with metabolic issues like obesity or high blood pressure. And while medication can help, your diet plays a huge role in managing and preventing gout flares. Today, we'll go over what gout actually is, the root cause and mechanism of disease, the worst foods that trigger gout, and the best foods that can help prevent it. Let's dive in. Gout is a type of arthritis caused by the buildup of uric acid crystals in the joints. These crystals form when there's too much uric acid in your blood, a condition called hyperuricemia. It commonly can affect the big toe, but it can also cause pain in other joints, including the ankles, knees, wrists, and fingers. Your body naturally makes uric acid when it breaks down substances called purines, which are found in certain foods and also made by your body. When uric acid builds up too much, either because you're making too much or excreting too little, it can form needle-like crystals that can get stuck in your joints. That leads to intense pain, swelling, and redness, classic signs of a gout flare. So if we can lower uric acid levels through diet and lifestyle, we can reduce flares and long-term joint damage. Let's start with what not to eat. These foods are high in purines or contribute to uric acid buildup and inflammation. Number one are red meat and organ meats. This includes beef, pork, and especially organ meats like liver and kidneys are purine-rich and can spike uric acid levels. Number two is seafood. Shellfish like shrimp, crab, lobster, and fish like sardines, anchovies, and mackerel are high in purines. Number three is alcohol, especially beer and liquor. Beer contains purines, and alcohol in general interferes with uric acid elimination through the kidneys. Number four are sugary beverages. Soda and energy drinks with high fructose corn syrup increase uric acid levels and worsen your metabolic health. Number five are processed foods. Things like hot dogs, deli meats, and packaged snacks often contain ingredients that can promote inflammation. Number six is high-fat dairy. While not as problematic as red meat, some studies suggest full-fat dairy can worsen metabolic syndrome, which is linked to gout. Now for the good news, there are plenty of foods that can help lower uric acid or reduce inflammation. Number one are cherries. Cherries and tart cherry juice are anti-inflammatory and have been shown in studies to lower gout flares. Number two are vegetables. Even purine-rich vegetables like spinach and asparagus do not seem to trigger gout. Load up on leafy greens, cruciferous vegetables, and colorful veggies. Next is low-fat dairy. Milk and yogurt can lower uric acid levels and have been shown to reduce gout flares. The low-fat varieties are key, not the full-fat ones. Next is water. Staying well hydrated helps to flush uric acid through the kidneys. Coffee. Some studies show moderate coffee intake lowers the risk of gout. Whole grains and legumes. Oats, brown rice, lentils, and beans are anti-inflammatory and do not worsen gout. And then there are healthy fats. Olive oil, avocados, nuts, and seeds fight inflammation and support metabolic health. Here's a bonus tip: watch your metabolic health. Gout doesn't just come from diet, it's closely tied to insulin resistance and metabolic syndrome. So along with changing what you eat, make sure to maintain a healthy weight, exercise regularly, avoid crash diets that can trigger flares, manage your blood pressure, cholesterol, and blood sugar as well. Here's some common gout frequently asked questions. Number one, can I ever eat red meat again? Yes, but in moderation. Small amounts of lean meat occasionally are generally okay if your gout is under control. However, if you notice that frequent red meat seems to flare up your gout, you do need to reduce the amount that you are consuming. Number 2, is wine safer than beer? Wine may be less risky, but all alcohol can affect uric acid levels. So best to limit it, especially during flares, and if you're flaring frequently. And then, should I avoid all protein? Absolutely not. Plant-based proteins and moderate amounts of lean animal proteins are still fine. To sum up, gout is caused by excess uric acid, often worsened by diet and lifestyle. Avoid red meat, seafood, alcohol, and sugary drinks. Eat more vegetables, cherries, low-fat dairy, and healthy fats. Don't just manage symptoms, address the root causes like metabolic dysfunction. If you found this helpful, make sure to like, subscribe, and check out our website at chicagoarthritis.com for more expert advice on staying pain-free and healthy. If you'd like a personalized approach to managing your gout or joint pain, contact us. Thank you for watching, and live well.